Oh, publications, my God, there's so much going on in dermatology. But I'm going to share one that I actually just reviewed, and it really excited me. So we'll start there. So talking about publications that are new and exciting. So our colleague, Raj Tovatia, just published 2 months ago in Dermatologic Therapy a great article on chronic hand eczema. And I don't bring this up just because I talked about it at this particular meeting, and we had a number of presentations at Derm 2025 about chronic hand eczema. But he really delved into the different subtypes, 7 or 8 different subtypes, depending on how you interpret the presentations of chronic hand eczema. So that was one really unique component. But one of the things he talked about, now, despite our colleague, Dr. David Cohen's being probably the world expert in contact dermatitis and patch testing, one of the things he talked about is not delaying the treatment because of how you're trying to diagnose perhaps one of those 3 critical subtypes in chronic hand eczema: the atopic component, the irritant contact dermatitis component, and that true allergic contact dermatitis component to chronic hand eczema. So one of the things he talked about was, while it is important to consider patch testing, consider it down the road, because we have the opportunity to treat our patients now with highly effective therapies, like with our newly approved delgocitinib pan-JAK inhibitor for treating hand dermatitis. And this is totally spontaneous, Andrea, too, but I literally just read this article about 2 weeks ago, and I thought it was fabulous. So that was really exciting to me. Another article that I reviewed that is just published in this last month was a great publication in the rheumatology literature by Len Calabrese. And interestingly enough, you and I have been talking about hidradenitis suppurativa. And so he reviewed all of the 3 clinical trials, the phase 3 clinical trials for those therapeutics that are now FDA approved for treating hidradenitis suppurativa. And I found the article kind of interesting, and I'll just summarize that one of the things he found, first of all, that all 3 of these agents are highly effective in treating our patients with hidradenitis suppurativa. We have a new agent in bimekizumab, which just approved in this past year, which I talked about in my presentation. But you'll find it very interesting that the data in this pan review and meta-analysis basically showed adalimumab and bimekizumab kind of neck and neck, and both highly effective, and maybe actually adalimumab, now again, not head-to-head, but somewhat superior to both dosing regimens for secukinumab at every 2 weeks and every 4 weeks, 300 milligrams subcutaneously. But by and large, all 3 therapeutics were found to be exceptional in managing our patients with HS. So I found those 2 to be rather revolutionary and exceptionally interesting articles in our dermatology literature.